Hi everybody, Dr. Daniel, and today I have exciting news. There's now one drug for migraine, and that's Nurtec ODT 75. Because Nurtec ODT has been approved for both acute and preventive migraine treatment, and it happened May 27th, 2021. That was a big day for the migraine world. We had the first time a single orally dissolvable medication, Nurtec ODT, was approved by the FDA. So this drug is a new release in 2020, and now it's been approved for acute therapy in 2020, and now for both acute and preventive therapy. And this drug is a CGRP antagonist that can be used with all previously FDA-approved drugs for both acute and preventive therapy. Now, this is big news. Now there's one drug for all of migraine. So Nurtec ODT is the only drug approved for this acute and preventive migraine treatment for adults by the FDA. The migraine process releases three neuroinflammatory chemicals, and they are CGRP, neurokinin A, and substance P. Nurtec OD, which is also the generic name rimegepant, blocks the effect of CGRP, which now is considered to be one of the most important inflammatory neurochemicals during the migraine process. And ODT means orally dissolvable tablet. The tablet is put in your mouth and then it dissolves. Water and a cup or glass are not needed. The drug effect onset occurs as early as an hour after taking it. Nurtec ODT is safe for migraineurs with cardiovascular risk factors. Nurtec ODT is compatible with most drugs, including CGRP preventive drugs for migraine, oral contraceptives, some antidepressants, preventive medication for migraine, and triptans for migraine. For prevention treatment, Nurtec ODT 75 milligram is taken every other day or up to 18 doses or treatments per month. Previously, persons with migraine had to take an acute therapy drug, usually a triptan at the onset of the migraine, but for persons who had migraine attacks at a level of 3 or 4 or more per month, most doctors at that level recommend a preventive drug. The choice here has been one of the older preventive drugs, such as amitriptyline, topiramate, sodium valproate, or propranolol, or one of the new CGRP preventive drugs. The new CGRP drugs are given subcutaneously every 1 or 3 months, and these drugs are Aimovig, Ajovy, or Emgality. Vyepti is given as an intravenous infusion monthly. Many headache specialists are prescribing Nurtec ODT along with another CGRP medication. So, related questions. What is migraine? Well, migraine is the third most prevalent illness in the world. The World Health Organization states that migraine is one of the 10 most disabling medical illnesses. Approximately 40 million people in the United States and hundreds of millions of persons worldwide suffer from migraine. And migraine comes with attacks lasting 4 to 72 hours, which are pulsating, often one-sided, and they can be moderate to severe pain intensity. Migraines come with nausea or vomiting and our sensitivity to sound or light. There's a significant unmet need for new acute and preventive treatments, as more than 90% of people with migraine are unable to work or function normally during an attack. That's why it's so disabling. Well, what kind of drug is this Nurtec ODT? It's a new type of migraine medication. It's called a GPANT, G-E-P-A-N-T class, and it's the second drug in that class to be approved for acute migraine attacks. Ubrevely, or Ubrogepant, was approved previously. It is also a GPANT. How does Nurtec ODT work? Well, this drug is a CGRP receptor antagonist. That means the drug blocks the activity of CGRP to aggravate migraine. The small molecule CGRP receptor antagonists represent a novel class of drugs for the treatment of migraine. This unique mode of action potentially offers an alternative to current agents, particularly for patients who have contraindications to use of triptans, or those who have poor response to triptans or intolerant to them. Something like 70 to 80% of persons are headache-free if they take a triptan at the onset of a migraine within 2 hours. But what does that leave? There's 20 to 30% of patients, it doesn't work for them. And also triptans are contraindicated for elevated high blood pressure and people with stroke or heart problems. So Nurtec ODT targets CGRP to treat migraine symptoms by blocking this CGRP receptor. And this is a protein found in the brain within the trigeminal nerve. When a migraine attack occurs, neurons of the trigeminal nerves in the face and the head become overactivated, and this causes the body to release peptides like neurokinin, substance B, and CGRP that lead to blood vessel dilatation, inflammation, and pain. Nurtec ODT works by binding CGRP receptors like a plug into a socket. So the socket is the receptor and the plug is Nurtec ODT. When CGRP is released, it cannot plug in because the socket's already full. This avoids CGRP from setting off the flow of inflammation and pain that comes with a migraine attack. Well, are there any research reports showing Nurtec ODT works for prevention? On April 13, 2021, Biohaven Pharmaceuticals, the manufacturer of ODT, Nurtec ODT, announced positive results on a phase 3 clinical trial for the preventive treatment of migraine in adults. And a press release for the company stated that the studies, quote, showed that Nurtec ODT demonstrated rapid onset of preventive treatment efficacy with reduction in migraine days observed within the first week of every other day dosing. Most previously used preventive drugs, like the older migraine drugs for prevention, will take 1 or 2 months to show some improvement, but Nurtec ODT works in a week in studies. So 21% of persons who tried Nurtec ODT were pain-free within 2 hours. What are the side effects of Nurtec ODT? The side effects are said to be minimal. Nausea is the most common side effect, present in 2% of patients. Serious side effects are a hypersensitivity reaction to the drug, or shortness of breath, or a rash. There is no black box warning which says there's some kind of problem with the drug. Who should not take Nurtec ODT? It's restricted to persons with severe kidney or liver disease and women during pregnancy and breastfeeding, and it's not advised for children or adolescents under 18 years of age. Well, I'm going to read to you what headache specialists say about Nurtec ODT. So Peter Gosby is a professor of neurology at the University of California, Los Angeles, and King's College in London. He stated, quote, the FDA approval of Nurtec ODT for the preventive treatment of migraine, along with its acute treatment indication, is one of the most groundbreaking things to happen to migraine treatment in my 40 years of practicing headache medicine. To have one medication patients can use to treat and prevent migraine will likely change the treatment paradigm for many of the millions of people who live with migraine. Nurtec ODT, with its novel, quick dissolvable tablet formulation, works by blocking the CGRP receptor, treating a root cause of migraine. With this targeted mechanism of action, Nurtec ODT provides a more complete, flexible treatment plan that gives people with migraine increased control of their disease. A single dose of Nurtec ODT can deliver fast pain relief that lasts up to 48 hours for many patients. The drug can be taken up to once daily as needed to stop migraine attacks, or taken every other day to help prevent migraine and reduce the number of monthly migraine days. This approval represents an important advancement in care for the several hundreds of millions of people living with migraine across the globe. For the first time, one medication can treat and prevent migraine attacks. All right. Vlad Korek, MD, is Chief Executive Officer of Biohaven, stated, quote, this FDA-approved drug approval makes the beginning of a new era of migraine treatments, allowing the potential for healthcare professionals to prescribe and patients to have a single medication to treat and prevent migraine attacks. Nurtec ODT is dissolving the line between acute and preventive treatment. This groundbreaking approach to treating the full spectrum of migraine disease, from acute therapy to prevention, can have a significant impact in a patient's life by helping to decrease treatment plan complexity and reduce challenges with adherence and polypharmacology. At Biohaven, innovation is the center of our focus, and we are committed to finding and advancing paradigm-shifting treatment options to help people with neurological illnesses so they can live life without the burden of these illnesses. The FDA approval of Nurtec ODT is based on a double-blind, randomized, placebo-controlled phase 3 clinical trial with an open-label extension. Primary study endpoint results demonstrated that Nurtec was superior to placebo, decreasing monthly migraine by 4.3 days per month after 3 months of treatment. The preventive effects of Nurtec were seen as early as the first week of their therapy. Further, a key secondary endpoint result showed that approximately half of Nurtec-treated patients had a 50% or greater reduction in the number of moderate to severe migraine days per month. Well, here's the patient speaking. Carolyn Armitage, a Nurtec preventive clinical trial participant, shared her thoughts. Quote, as a middle and high school teacher, I know how important it is to show up every day for my students. I value the opportunity my career provides me to help shape young minds and lives. But having a migraine attack almost 3 times a week has had a devastating impact on my professional and personal life. I was not able to be present for my students, family, or friends. After trying Nurtec ODT through the clinical trial, I'm so pleased that the frequency and severity of my migraine have subsided, making them much more manageable. A recent survey preventing migraine attacks. A current perspective by the National Headache Foundation confirms that 84% of people taking a preventive treatment wish there was a better treatment option available to them. Among respondents, 53% wanted more migraine-free days, and 67% reported that the risk of anxiety and depression increases as the number of migraine attacks increase. Nearly all respondents, that is 98%, reported that they are willing to consider a new oral treatment. Okay, I've got another expert here, Dr. Richard Lipton, a headache specialist and director of the Montefiore Headache Center in New York, explains, quote, the availability of the GPATs makes it possible to effectively treat patients whose needs could not be met by previously available treatments. These drugs are great news for people with migraine and for the clinicians who treat them. He explains that patients who will benefit from the new drug include people who cannot take triptans, those who do not benefit from triptans, or have cardiovascular conditions which would contraindicate the use of triptans. Also, if overused, triptans may make migraine worse by causing medication overuse headache. Said Dr. Lipton. While the term medication-induced headache is controversial, the phenomenon that overuse of medications that relieve headache can lead to more headache is well known. Available evidence suggests that CGRP blockers prevent migraine, giving rise to the hope that they will not cause medication overuse headache. Dr. Lipton explains, Rimegepant ODT is a novel acute treatment for migraine. It is a melt-in-your-mouth, under or on top of your tongue tablet, which shows statistically significant effects on pain relief and restoration of function at 1 hour after dosing. What is the price of Nurtec ODT? The price is about $850 for an 8-pack. This is similar to Ubrevely, which is about $850 for a pack of 8 pills. A lower price can be paid depending on insurance pharmaceutical coverage. Nurtec is a new name brand drug, which is more expensive than any one of the 7 triptans, which have been available for over some of them 30 years and are all generic. Nurtec is priced similar to other newly approved drugs. What's the insurance coverage for Nurtec ODT? It's impossible to accurately answer this question because there's so many different pharmaceutical insurance plans, and they're all different. Some insurance will cover all or part or none of Nurtec ODT. Also, many insurances require that a requesting patient fail 1 or 2 of the triptans for acute therapy of migraine before they'll allow Nurtec to be dispensed. So you got to try the drugs before you can get it. The situation will improve the longer the drug is on the market. The new medications are more expensive than triptans, which have been around long enough to have generic forms available. The price of Nurtec ODT is compatible with other approved drugs like that. So Biohaven Pharmaceuticals has a patient savings program for eligible patients with commercial insurance. Biohaven is committed to supporting the migrant community by eliminating barriers to medication access. The company plans to continue the zero copay card, in which eligible patients will pay as little as $0 for eligibility requirements, and to enroll in the patient support program. There's a phone number they give that you could try. There's a Nurtec.com webpage So please check in on my blog at drmigraine.com, and please consider reading my big book on migraine, which is available at Amazon, and the little book I have in the mini neurology series on migraine. I'm also talking on other podcasts, over 100 podcasts I've made on migraine in the last year, and I have YouTube videos as well. God bless all you folks with migraine. Hopes this helps with this information, and praise God, we got a new drug here. Hopefully it worked well for all of you. Bye-bye.